And we'll allow these attendees to join. Oh, they're in here already. Great. Thank you so much for joining us today. I have here with me Bob Williams. We're going to be working through our next installment of the Ask a Professional series. This installment is called Healthcare Marketplace, and we have a great speaker on this topic here with us today, who's just one floor below me in the Woolfolk State building here in downtown Jackson. Bob has been in the insurance industry in Mississippi for over 32 years, beginning his career at Blue Cross and Blue Shield, and is now the director of Life, Health, and Actuarial Division at the Department of Insurance. Bob, you're welcome to take the floor and share with us today your presentation.
Thank you so much for having me today. I appreciate it. I hope I'm going to share some information today that'll be helpful for everybody that's on the webcast. And I have a PowerPoint, and what I'd like to do, I want to cover small sections of it and make this interactive. We can stop and take questions and see what everybody's thinking as we go over this information. So if that's fine, I'll get started. So a lot of times we have people that say, I keep hearing about health insurance exchanges, but what does that really mean? So there is a health insurance marketplace or a health insurance exchange. And what it really is a platform or a portal that consumers like yourselves can use to purchase private and family health insurance plans and receive income-based subsidies to make the coverage more affordable. And I'll go into some more detail on that. But every state has something a little different. Some states have state-run exchanges, and some states have federally run exchanges. And Commissioner Cheney worked hard about 8 years ago for ours to be a state-run exchange, which we felt like would have been better, but that did not get approved, and ours is a federally run exchange. And although it is, we work really closely with CMS and healthcare.gov as well as consumers, because a lot of the questions come to us, and when they have issues, they come to us. And so Mississippi uses healthcare.gov. So how do I buy my health insurance through a marketplace? You're not required to buy through the marketplace because there's no longer a federal penalty for not having health coverage. At one time, when the Affordable Care Act was passed, there was a penalty, and you would check a box on your tax returns, and if you didn't have health care coverage, there was a penalty. But that has since gone away. But if you don't buy your coverage through the exchange, you cannot obtain a premium tax credit or cost sharing reductions. And so let me just tell you a little bit about those. If you buy through the exchanges, and depending on your income levels, you can actually receive a subsidy. And so let's just say the policy would have normally cost $800. With the subsidy, it could cost $100 or $70. And if you qualify, there are also cost sharing reduction, which means the deductible or the out-of-pocket might be also covered by the federal government. So this is really helpful for people that are not able to afford health insurance coverage, and that's what the marketplace is for. So who is eligible to use the marketplace? With exceptions of people that are enrolled in Medicare coverage, virtually all Americans are eligible. I'm sorry.
1 second. Sorry, your slides are not advancing. I wanted to let you know we're still on the first one.
Oh, okay.
So I don't know if you have to physically click on the left panel there to advance your slide.
Are they advancing now?
I'm still on that first slide.
I'm sorry. No, you want to? Y'all excuse us just a minute. We'll see if we can correct it.
Apologies. There's always going to be some technical issues.
Is there a bad thing there or?
Sorry about that. All right, let me pick up where I was. So I think I was talking about who is eligible to use the healthcare marketplace. Are you seeing that?
Yes.
Okay. So with the exception of people who are enrolled in Medicare coverage, virtually all Americans, as well as Mississippians, are eligible to use healthcare.gov. However, the marketplace was designed to provide coverage for individuals and families who were either uninsured or already buying their own health insurance coverage. This includes people who are self-employed, people who are employed by small businesses that don't offer health benefits, and people who are retired before the age of 65 and they're too young to be covered by Medicare. Okay, so how do I get coverage through healthcare.gov? Well, when applying during the open enrollment period times, which I'll share with you those later, you go to www.healthcare.gov to apply online. And this is the fastest way to apply. You log in and create an account to get started. You can find help in your area. You can enter your zip code for a list of local people and organizations that can help you. And those are called navigators. And each state has several navigators assigned to it to help people on the exchange and to use the exchange. There are also certified enrollment partners, like agents and brokers. You can roll over the phone. You can fill out and mail a paper application. Each state's marketplace has its own enrollment instructions. And during the marketplace's enrollment period, you can choose a plan for the first time or continue the plans you have. So I mentioned open enrollment periods. Let's talk about what an open enrollment period is. So an open enrollment period is a window of time that happens once a year, typically in the fall, when you can sign up for health insurance. You can adjust the plan or cancel your plan. It's usually limited to a few weeks, and if you miss it, you may have to wait until the next enrollment period for the next year. If you apply for health insurance coverage through your job, through Medicare, or through the Affordable Care Act marketplace, you will have an open enrollment period. So for individual and family Affordable Care Act marketplace exchanges, the open enrollment period is from November 1st through January 15th in most states, and that's true here in Mississippi. For health insurance during the workplace or through your workplace, enrollment periods are set by the employer, but they're typically in the fall. And then Medicare's annual enrollment period is October 15th to December 7th, and most people are around the age of 65 when they enroll. So what companies are part of the exchange in Mississippi? And we are so fortunate. We actually have several major companies that are on our exchange, and they're all in all 82 counties. So you have lots of choices. But UnitedHealthcare, which is one of our great corporate citizens in Mississippi, they are on the exchange. Also, Ambetter Magnolia, they're on our exchange. Cigna is on our exchange. Vantage Health Plans of Mississippi, which is out of Louisiana, is on our exchange. And then UnitedHealthcare is back on our exchange. They had previously left the market at the end of 2016, but they've returned. But the reason we're excited about this is that you have choices of different companies and different plans that you can go with. And when the exchange first started in Mississippi, we only had one player. And so, of course, the commissioner has been successful in getting other carriers to come in and be a part of the exchange. So how do I qualify for a subsidy? You can qualify for a healthcare subsidy if you make up to 4 times the federal poverty level. So let's take an example, which is about $47,000 for an individual and $97,000 for a family of 4. Thanks to the American Rescue Plan and the Inflation Reduction Act, individuals with incomes up to 150% of the federal poverty level can now receive a financial subsidy that will cover all of the majority of their monthly premiums. So this is really great. And you'll find here in Mississippi, almost everyone that's on the Mississippi Exchange, 97% of them have a premium subsidy versus about 90% nationwide. And this is not surprising because since these subsidies are based on income and Mississippi has the lowest average income in the US, it's not surprising that people can receive those subsidies. So what if I still need coverage for 2023 and the open enrollment period is over? Can I still get health coverage? Yes, there's a couple of ways. If you qualify for a special enrollment period due to a life event like losing other coverage, getting married, or having a baby, or based on a change in household income, then you may have a special enrollment period. If you qualify for Medicaid or the Children's Health Insurance Program, you can apply for those programs anytime by visiting www.access.ms.gov to learn more about those programs. All right, so I'm going to stop here before I go into talking about guaranteed issue rule, and let's see if there are any questions from the folks that are on with us today. Christy, you're muted.
Thank you. I was trying to minimize the background noise. So I see Andy's got her hand raised, which is exactly what I was saying. If you raise your hand, I can allow you to unmute yourself. So Andy, you can now unmute yourself and ask your question.
Okay, can y'all hear me?
Yes.
We can.
Okay, so I've been using the marketplace since it started, and it's been a wild ride. There was just Ambetter, and it was okay because I got health insurance, but now I'm literally paying this year almost $900 for my health insurance through the marketplace. Just for myself. My kids are all grown now. Just my health. That's not my dental or my vision, because my dad died and I got an inheritance this year. And so it's pushed me up into a tax bracket. And it happened, my dad died in the middle of the year, so I couldn't get any other insurance. Can I get insurance outside of the marketplace? I work for myself. Can I go outside of the marketplace, because I can't afford the marketplace anymore?
You can go and check for individual coverage with Blue Cross Blue Shield of Mississippi. Just as an example, you can go on their website and look at their Blue Care programs. I'm not saying that it'll be cheaper. I think probably that change in income and inheritance may have caused you to maybe move out of a different income level, which would have affected the payment in the exchanges. But I would try to go on Blue Cross's website and look at those policies.
Okay, yeah, because they won't ask for my income, right? They don't ask for your income, right?
No, they're not going to ask for your income.
Okay. And do you have to have will they like at the marketplace, it's really great because you don't like, it's no problem if you have a pre-existing condition. When you go outside of the marketplace, will they require that they also can't ask you if you have a pre-existing condition, correct?
Yeah, you shouldn't have a problem with that.
Okay, great. Thank you for your help.
Sure.
Thank you, Andy. Does anyone else have a question they'd like to ask at this time? You can also put a question into the chat if you don't want to have your voice on audio recorded. So that's also an option. We'll be monitoring that chat. All right, thanks, Bob. I think we can keep moving forward.
Okay, so the next section I want to take you through.
Oh, wait, Bob, I did get a question in the chat.
Okay, great.
What do you mean by subsidy? I think you went over it earlier, but maybe
Okay,
a little bit more in detail.
yeah, I'll be happy to cover it. So what the Affordable Care Act did is that it set up different income levels, and they ride on a scale of what's called the poverty level. And all the word poverty is in there. You can see from my slide the incomes that people are making, like an individual up to 47,000 or a family up to 78 or 80,000. That's not necessarily considered poverty, but what it did is, depending on where you were in that scale, then the federal government says, okay, we are going to provide you a tax incentive to help you pay your premium for your insurance coverage. And the way most people do that is the federal government pays that all during the year. They pay it not to you, but to healthcare.gov. And then it goes from that to the insurance company in order to pay a portion of your premium. And like I was explaining earlier, that premium might be $800 and $900, but depending on where you are on that poverty scale, that tax incentive could reduce that significantly down where you could afford the coverage. And that was the whole point, is a lot of people that were not covered in the United States before the Affordable Care Act and the uninsured, this allowed those people to be able to obtain coverage.
Thank you so much. Did that answer your question? And I'll give them a moment to type into the chat. All right, I think we're good to go.
Okay, so the next section I'm going to cover with you is, what is the Affordable Care Act's guaranteed issue rule? And this is important for people to understand in connection with their health insurance policies. But guaranteed issue in health insurance refers to the circumstance in which a healthcare policy is offered to any and all eligible applicants, regardless of their health status. And of course, we kind of had that question earlier. And this should say prior to 2014, I'm sorry, it says 2024, but prior to 2014, individual market health insurance, the kind you buy on your own, rather obtaining from an employer, was typically not guaranteed issue. Instead, the insurers in most states based the eligibility on the applicant's medical history. So that gets back to, you had to fill out the application to purchase the individual coverage. And if you had pre-existing conditions, then they did not have to sell you the coverage. It wasn't guaranteed issue. But that changed when the bulk of the Affordable Care Act provisions were implemented in 2014. Sorry about that.
No worries. I can see the what is the ACA guaranteed issue rule slide.
Okay.
It's changed now.
Let's see. Good. Let me make sure. All right. So are you seeing what is meant by guarantee availability?
I am.
Okay, great. So guaranteed availability of coverage refers to the federal law, which states that any insurance issuer that offers health insurance coverage in the individual, small group, and large group market in a state must offer to any individual employer in the state all products that are approved for sale, and they must accept those individuals' employers without those health conditions. So how does the guaranteed issue rule help me? So the guaranteed issue rule makes it easier for individuals with pre-existing medical issues to obtain health coverage as their medical history is not taken into consideration. So this is something it's really important to understand. Since it's called guaranteed availability, can I purchase coverage at any time throughout the year? So although individual and family health coverage is now guaranteed issue, coverage is still only available due to the annual open enrollment periods. And we covered those before, November 1st to January 15th, or during a special enrollment period that is triggered by a qualifying event. Prior to the Forbear Act, individual and family coverage could be purchased at any time. So let's talk about what a qualifying event is. That might be a little confusing, but what allows us to purchase coverage? So it may be an involuntary loss of coverage. Maybe you left your job and you're trying to purchase individual coverage, and that would be a qualifying event for you. Or you became a dependent, or you added a dependent, and you may need to provide coverage for them. Marriage is a qualifying event. Divorce is a qualifying event. Becoming a United States citizen is a qualifying event. Moving, making a move out of state is a qualifying event. An income increase that moves you out of the coverage gap is a qualifying event. So those are various examples of what qualifying events are. So what are the responsibilities of the insurance carriers under the guarantee availability of coverage? All right, so back to enrollment periods. The health insurance issuers may restrict enrollment in health insurance coverage to the open or special enrollment periods. So for the group marketplace, it's a little different. The health insurer in the group marketplace must allow an employer to purchase health insurance for a group plan at any point during the year, which is a little different than what we talked about on the exchanges and for individual coverage. But in the individual market, a health insurance issuer in the individual market must allow the individual to purchase health insurance coverage during those initial and annual enrollment periods that we went over before. What are the responsibilities of insurers under guaranteed availability of coverage? So again, limited open enrollment periods and also special enrollment periods. So let's look at length of the enrollment periods. In the group marketplace, enrollees must be provided 30 calendar days after the day of the qualifying event to elect coverage. In the individual marketplace, they must be provided 60 calendar days after the day of the event to elect coverage, as well as 60 calendar days before certain triggering events. If you apply during those periods of time, the effective date for coverage for limited open and special enrollment periods must become effective consistent with the dates prescribed by the law. All right, so let's talk about barriers to guarantee availability of coverage. So although we may be able to receive coverage, there is a problem because there's a shortage of places to go in certain rural areas. And we can take our own state of Mississippi and look up in the Delta where there's not as many hospitals, not as many providers as there used to be. So although you could have coverage, you may not have a provider close to you. The second thing is, and if you've been keeping up with this, the rural hospitals in the state of Mississippi are in financial trouble. And there's a lot of discussion going around about that and how to fix it. But let's just take Greenwood-LaFleur Hospital and the town of Greenwood. That is one of their major employers, major healthcare provider for that town. And it's concerning to think that that hospital might go under, and we hope not. But when we say barriers to coverage, just because you have it doesn't mean there's providers in your area. When does guaranteed availability not apply to coverage? The general rule concerning applications of the guaranteed availability requirements do not necessarily apply to health insurance covered offered in connection with group health plans that have fewer than 2 participants that are current employees. So that's getting back to numbers. If they're claiming to be a group health plan, but there's fewer than 2 participants, then the insurance company doesn't have to follow the guaranteed availability rules. Is there any coverage that is exempt from the Affordable Care Act rules? And yes, there are. So there are policies out there that are called short-term health insurance policies, and these type of health insurance are designed to cover you for a short period of time, maybe 3 months or less. Unfortunately, those policies have pre-existing conditions. Then you may have heard of healthcare sharing ministries, and this is the type of religious-based health insurance where members share in the cost of medical bills. We are a little concerned about those type of plans because basically what you do is you pay into those plans, and then if you need to have surgery or something to that effect, then hopefully there's enough money paid into that plan for your surgery to be covered. However, the problem with that is if there's been a large bill prior to yours, then they may not have enough reserves to pay for your coverage. And then there are the grandfathered plans, those plans that were in existence before the Affordable Care Act came into being and had been purchased before those, and they were exempt from the coverage requirements. So I just lost my job and cannot afford to keep up my current coverage. What should I do now? So we suggest go to www.healthcare.gov, as this is considered a qualifying event that should make you eligible for special enrollment. What happens to my health insurance coverage if I move out of state? And this is really a good question. If you move to a different state, you will likely need to get a new health plan. Most health insurance plans are tied to the specific state you're in, so your current plan won't cover you in a new area. If you have an employer-based health coverage and find out if your plan in the state of residence you're going to would still cover you. If you're moving to a state that's outside of your plan's service area, you may need to find a new health plan. So always check into that if you're making a move or a change. All right, so before I go into resources here at the Mississippi Insurance Department, let's stop again and let's see if there are questions.
Sure. I don't have any submitted in our Q&A, but if there's anybody who would like to ask a question live, you can raise your hand and I'll allow you to unmute yourself. Going once. Going twice. We're good to go.
Okay. All right. So the next section I'm going to cover with you are resources at the department. And I think this will be great for everybody to kind of know what's here and what's on our website and how you can use it to help in connection with health insurance and understanding health insurance. But you can go to www.mid.ms.gov and you'll find icons that are clickable links to navigate to landing pages within our department's website. So today I'm going to share with you what I call health insurance literacy and consumerism. So kind of want to show you what's there on our site. All right, so consumer literacy, these tools help understand the different types of insurance. You'll need to find the index, and using the index below, you go directly to a particular section on the page. So for instance, you go to the index and you click on health insurance and you, and there's a whole section there that'll provide you information in connection with what health insurance is. Or you could click on purchasing health insurance and it would have a discussion there or help you a little bit like what I've gone through before. Types of insurance we've touched on, everything from group to individual, but there's a very detailed section there that you can look at. Disclosure requirements, and then there's complaint procedures, which we'll go over in more detail in this section. You'll also find a section called Managed Care Plans, which we'll talk about a little bit later. Shopping for insurance, questions about coverage, questions about premiums, questions about providers, and questions about customer service here at the insurance department. There's also a section on lowering your health insurance premiums and getting assistance from the Mississippi Insurance Department. So types of insurance. There are several kind of types of insurance. Traditional insurance is often called fee-for-service. And if you have a traditional insurance plan, the insurer pays the bill after you receive the service. Most what you see now, though, are managed care plans, where you pay a monthly payment and you're covered for most of your medical expenses. And those are known as PPO plans. So managed care plans provide health care in a more structured way from traditional insurance. The plans encourage you to go see doctors and hospitals in their network. So let's just use that for an example, and we can use Blue Cross Blue Shield, and we can use UnitedHealthcare. You know, let's say you have one of their exchange products. We'll use UnitedHealthcare because they're on exchange. Well, they have a network of hospitals and providers, and it's a very large network, and you will find that the majority of your doctors or hospitals are in that network. But if you go to those providers in the network, then you won't be balanced billed. Those hospitals and providers will take United's payment in full, and you're only responsible for things like your copay, co-insurance, or deductible. There are many different terms that are used in discussing healthcare, like covered persons or enrollees. You know, so those generally, when you read that, that's just who's enrolled in the plan. The word provider is used a lot, and those are the doctors, hospitals, pharmacies, labs, urgent care facilities, and other care facilities. And so when you see provider, when you're reading your contract, that's what that's referring to. There's a glossary of health insurance terms, which are very helpful. Many consumers don't understand the health insurance terms that are contained in the marketplace materials. I mean, it's hard for even people that are in the industry. But at the MID website, you can find a glossary of health insurance terms. You can click on a letter in the index, and it'll take you directly to a particular section in the glossary. So let's use this as an example below. You see, this is an example of what you would see if you were in that glossary, and you could go and click a letter, and it will take you to a particular term. So let's look at some examples. So if you clicked on A, it would take you to the Affordable Care Act, and we've been talking about that. The ACA was signed by President Obama on March 23rd of 2010. And as we've gone through before, it provides a mechanism for people to receive subsidy and tax credits so that they can afford health insurance coverage. But if you didn't understand the Affordable Care Act, you could go to that part of the index. Balanced billing. Here's another term let's talk about for a minute, because you could be affected by that. When you receive services from a healthcare provider that does not participate in your insurance company's network, the healthcare provider is not obligated to accept the insurer's payment as in full and may bill you, and that amount is called balance billing. Now, let me tell you one great protection that we have here in Mississippi. We have a Mississippi law that prevents balance billing if you go to an out-of-network provider, but you assign, let's say, Blue Cross Blue Shield to pay that out-of-network provider directly, and that provider takes Blue Cross and Blue Shield's payment, then that law prevents that non-network provider from balance billing you. They can only bill for the deductible and out of pocket. So keep that in mind if you ever run up against a balance billing issue. So what's a beneficiary? That's just a person or party that's named by the owner of the insurance policy to receive a policy benefit. You see that a lot in life insurance. What is case management? You will read about that in your policies, but these are just functions that are performed by physicians, nurses, and social workers, specifically with specific diagnoses of those with high health care needs. You may hear about COBRA. Well, COBRA is the law, it's a federal law that provides certain former employees, retirees, and spouses the right to keep their health insurance coverage at their group rates for a period of time. If there's a death with your spouse, the wife or husband can go on for a period of time up to 18 months on COBRA coverage, and it allows them to seek other coverage somewhere else. So it's a protection.
So Bob, I did get a question in the chat here. If you
Okay.
What you said to keep in mind about balance billing.
Yes.
Mm-hmm.
So that you want me to go back over that?
Yeah, if you don't mind, I think somebody was looking to see if you could explain that again.
Sure. So here we go. So what balance billing is I go to, I'm in the Blue Cross Blue Shield network, but I go for some reason and I see a doctor that is outside their network. If I go see that doctor and they get a payment from Blue Cross, they could balance bill you, which is the difference between the amount Blue Cross paid and their total charge, what that doctor's total charge is. For instance, the doctor's total charge may be $1,000 and Blue Cross pays $500. Well, they would bill you that difference. Now, some states do not have a balance billing law like Mississippi does that gives you protection against that. And we have a law on the books in Mississippi that says, if I go to a non-network provider and while I'm there and I'm signing in to see the doctor, a lot of times those doctors will have what's called an assignment. And when you sign that, you're saying, doctor, I give Blue Cross Blue Shield permission to pay you directly, even though you're out of network. Because normally if they're out of network, what happens is the payment's going to come to you. But if you assign your benefits from Blue Cross to that doctor and the doctor takes that payment, then the doctor, under the laws of the state of Mississippi, cannot come back and bill you for that difference we talked about, that $500. They couldn't bill you for that.
Thank you. I appreciate it.
Okay, so let's look at the term co-insurance. A lot of people don't really understand that when they read their policies, but that's a percentage of the healthcare provider's charge for which the patient is financially responsible. So let's say you look at your insurance policy and it says that when I go to the hospital, the insurance company is going to pay 80% of that visit, but I, as the policyholder patient, am going to pay 20%. Well, that 20% is what your co-insurance is. All right, you might click on the commissioner of insurance. And so our commissioner is an elected official and he oversees every aspect of the Mississippi Insurance Department. And in terms of rate review, the commissioner has the final say as to whether a rate may be implemented or we may disapprove that rate, requesting more information. The commissioner is also the fire marshal here in the state of Mississippi.
Is that by rule or coincidence?
It was the way it was set up some time back. He was not only tasked with the responsibilities of being the insurance commissioner, but he was also the state fire marshal.
I did not know that.
So, and someone may click on copayment. So copayment is a fixed amount, for example, $20 that you would pay for covered healthcare services. So under some contracts, whereas like we talked about earlier, the co-insurance amount is 20% for you and the health insurance company pays 80%. Your policy may have a copayment, and it may be a copayment for you going to see a doctor. And so instead of you having to satisfy your deductible, which we'll talk about in a minute, you would go see the doctor, you would pay that $20 copay, that would cover your visit in full, and the insurance company would pick up the rest of that. So what's a deductible? And that's the amount the patient must pay for healthcare services each year before the insurer will begin paying claims. So for instance, your policy may say you have a $1,500, you have a $2,000 deductible. And so you will have to pay that much in before your policy will begin to start covering, like we were talking about earlier, pay 80% toward that hospital visit. The deductible has to be satisfied first. All right, sometimes you'll hear the word ERISA, and ERISA refers to the Employment Retirement Income Security Act, and this is a federal law, and it's very complicated, but it applies to employee benefit plans and plans covering healthcare benefits, and it's a term that you see a lot out there in the industry. So exchange, we've talked about this. I'm not going to spend a lot of time on it, but we know the exchanges are out there. We know we have a federal exchange in Mississippi, and you're able to go receive coverage there. All right, so what's a formulary? So a formulary is a list of drugs covered fully or in part by the health plan. Okay, so I like this little cartoon. It says the patient is saying to the doctor, just look for something in my price range, nothing outside of that. All right, another thing you'll find out on our website is what's called Healthcare Questions and Answers, and it's another great resource. And if you look out there, we have one area called Health Insurance 101 and Balanced Billing. We have Health Insurance 101 and Long-Term Care. We have Health Insurance 101 and Mental Health Parity. And we have Health Insurance 101 and Preventive Services. So let's just look at the one called Health Insurance 101 and Long-Term Care for just a minute. So what is long-term care? And this is important too, and it's something that's in the news a lot, but long-term care is a policy that involves a variety of services designed to meet a person's health care or personal care needs during a short term or a long period of time. And a lot of people purchase these policies to help themselves. What types of services long-term care provide? You see things like, you see this if people may have an acute illness, that maybe they've had a heart attack, maybe they've had a stroke, or maybe they've had some type of surgery where they need certain home-based services. So in long-term care policies, you'll see things like home health care, homemaker services, emergency response systems. You'll see community-based services, adult daycare services, and transportation. And you'll see facility-based services like adult foster care, board, and care homes. Are we still online?
Yes, we are. There was somebody at my door. I just needed to go.
Oh, okay. So why do people need long-term care? Like I talked about, they may have a serious ongoing health condition or disability, and the need for long-term care can arise suddenly, such as I talked about a heart attack. Most often, however, it usually develops gradually as people get older and frailer and that they need these services. So what is the most common type of long-term care? The most common type is personal care, help with everyday activities, also called activities of living. And these include things like bathing, dressing, grooming, using the toilet, eating, and moving around. So that's what most long-term care is used for. All right, let me stop there a minute. I've been talking a while and see if there are any questions.
We do have a question, and it kind of goes back to those the prescriptions. Is there anything that an individual can do when the insurance will not pay for medications that a doctor has appealed multiple times? Is there a reporting, complaint, or investigation process at the state level?
Yes, you can. You can bring that to us and we will see what we can do. Sometimes you can go through an appeals process with the company, and after that, if they're denying it on medical necessity, you can qualify for an external appeal, which means that it would go out to an independent physician, if you will, that will review the records and everything, and they may end up agreeing with the insurance company, or they may not. And then the insurance company would have to provide it. And you're going to see here at the end of these slides, which y'all can use, it actually provides you the process of doing that. Or you're happy to contact me as well.
All right, thank you, Bob. Are there other questions? Again, you can raise your hand or put something in our Q&A or in the chat. Going once, going twice. All right. Looks like we're good to keep going.
Okay, so let's talk about autism insurance for a minute, because this is really important. But the Mississippi Insurance Department is charged with enforcing all laws that apply to the business of insurance. And one of those is during the 2015 legislative session, the Mississippi legislature enacted House Bill 885, which mandates insurance coverage for various types of autism and autism spectrum disorder, in addition to establishing a license process for certain providers of autism services. So this was a great move on the part of the legislature. So what the law says, except as otherwise provided, and health insurance policy shall provide coverage for screening, diagnosis, and treatment of autism spectrum disorder. So no insurer can terminate coverage or refuse to deliver, execute, or issue or renew coverage to an individual solely because the individual is diagnosed with autism spectrum disorder. And you see this a lot. It's out there more than you would think it is. All right, I also have another comic I'd like to share with you. And so this couple is sitting in front of their insurance agent, and he says, option A covers a defibrillator treatment. So, if your heart stops, the insurance cover will cover that defibrillator. But option B covers someone rubbing their feet on the carpet and touching you. So I just kind of think that's amusing. So there's an autism hotline. If you have questions about your coverage or if you feel your rights have been violated, then please call our customer representatives. They are available between the hours of 8 and 5 at 1-833-488-6472, or you can email consumer@mid.ms.gov. All right, let's talk about telemedicine in Mississippi, which is very important since we have many areas of our state where we talked about earlier that we don't have a lot of access to providers. Also, telemedicine was very important back during the pandemic because there were many people that wouldn't have seen their physicians, especially in the mental health arena. There were lots of people that probably wouldn't be with us today if they hadn't been able to use telemedicine and reach out to their doctors for treatment. But at any rate, telemedicine under our law here in the state means the delivery of healthcare services such as diagnosis, consultations, or treatment through the use of interactive audio, video, or other electronic media. Why is it so important? It's kind of like what we talked about earlier. The shortage in the Delta or the other rural areas of Mississippi. Telemedicine plays a really important role providing that what the patients need. Does my health insurer have to cover telemedicine visits? And the answer to that is yes. And they have to cover it to the same extent that it would be covered if you were seeing your doctor in person. Is telemedicine here to stay? And I'm happy to say it is. So Senate bill, which the commissioner worked really hard on this, 2738. Let me tell you what it did. But before this bill, our telemedicine laws in the state did not allow telemedicine between the patient and the provider. What it used to allow is that you could go see a doctor, and if you were in that doctor's office, then y'all could call over to another doctor's office. Well, that pretty much was worthless during the pandemic, and it's not practical even when the pandemic it's not like it's been in the past. So new law that was passed, 2738, did away with that. And it set up that, you know, if I have a provider and they do telemedicine services, I can pick up my phone, my iPhone, and I can receive those services through the physician under the way the law is set up now. All right, so another one of my cartoons. So the doctor says to the patient, first, we're going to run some tests to see how your insurance reacts. So seeing if they're going to, pay for it. All right, so let's stop there. Does anybody have any questions on telemedicine?
I don't have anything in the chat or the Q&A. I'll give people a moment to raise their hands or put something in since we're taking a second here. All right, looks like we're good to go.
Okay, so I talked about, and the person that I asked earlier, this is a good question. So here's some ways to receive assistance from our agency. So you can request assistance in insurance matters by calling our toll-free Mississippi Insurance Department consumer line at 800-562-2957, or locally you can call 601-359-2453 in the Jackson area. You can file a complaint. You can file an online complaint. You download our complaint form. It gives you where to submit the complaint, the required information with submitting the complaint, and more. And you click for the information on the filing on the company. You can mail a request to us for assistance to the Mississippi Insurance Department Consumer Services Division, P.O. Box 79, Jackson, Mississippi. You may visit our offices located at the Woolfolk State Office Building on the 10th floor here in downtown Jackson. That's 501 Northwest Street, Jackson, Mississippi. There's a visitor parking is located on the street, and there's some connecting parking in our garage.
And if you've been to visit us here at MAC, it's the same building.
That's exactly right. You may also email and fax. General inquiries and other matters may be sent via email at consumer@mid.ms.gov or by fax at 601-359-1077. There is essential information. Be sure to include your mailing address and telephone number with any correspondence directed to the Mississippi Insurance Department. So where to file a company complaint if you're trying to file a complaint on an insurance company? To file an electronic complaint, you may use the electronic online consumer complaint form. By doing so, we will receive immediate notification of your complaint. It will be signed to one of our consumer service specialists. Online consumer complaint forms, note all supporting documentation must be emailed, faxed, or mailed to us within 2 working days of filing the complaint online. You also may download and print an Adobe Acrobat Reader, the complaint form below, fax or mail the completed form to the fax number, and you see it there. To request a form by mail, you may call 1-800-562-2957 or 601-359-2453. The following information must be included in your order for us to process it: your name and your relationship to the insured, a daytime telephone number, the name of the insured's address, name, address, city, zip code, and phone number. The name of the insurance company with which you're having a problem, the address of the insurance company with which the insured is having the problem, and the type of insurance policy number, claim number, and date of loss, and a description of the complaint, and the form has been signed and dated. So what happens when we receive your complaint? Once we receive your complaint, it will be assigned to one of our consumer specialists who will review it and take the necessary steps to resolve the matter. Please allow us 20 working days to contact the company or the agency that is the subject of your complaint, and we will notify you in writing of our findings. So guys, that's all, folks. That's all I have today, but I definitely will stick around for questions.
And thank you so much, Bob. We really appreciate you taking time to put all this together for us. I will be sharing a recording of today's webinar on our website at arts.ms.gov. And you can look on our Tools for Creators page for this and all other installments of the Ask a Professional series. Any questions? All right, well, as Bob told you earlier, if there are anything that you have come up in the future, they do have resources on the Department of Insurance website, and you're also welcome to reach out to their staff. They're very friendly. I've been talking to them all month. So thank you all so much for taking some time and joining us today for this session. You can suggest future topics on that Tools for Creators page if there's something you'd like to see us cover in the future. Y'all have a great day.
Thank you.
I kicked everybody out.
Okay.